by the way. All right. I'm Bob Sanborn, President and CEO of Children at Risk and a part of the Texas Family Leadership Council. And we're doing a series of press conferences around the state to really highlight key groups in our population that are hesitant about the COVID-19 vaccine. With me today are a number of experts in this area. Allison Winnicky is with us. She's the President and CEO of the Immunization Partnership. Welcome, Allison. Also with us and a strategic partner in research is David McClendon, a principal with January Advisors. David, nice to see you. Also, Dr. Claire Bikini. She is a pediatrician and an infectious disease specialist with Texas Children's Hospital in Houston. Also, Dr. Anu Parktop. She's the medical director for health equity at Cook Children's Healthcare in Fort Worth. Dr. Parktop, welcome. And then Leah King is the head of the United Way of Tarrant County. Leah, thank you very much for being with us today. There are 29 million people in the state of Texas. 21 million of those are ready today and qualify today for a COVID-19 vaccine. Yet we've only received about 2 million doses, and only 50% of those, about 1 million, have been given to people. In Dallas County, less than 3% of the population over 16 has received that vaccine. So 97% of Dallas County is unprotected. Tarrant County, the same, only 3%, 97% unprotected. When we look at what's going on, we know that Texas is by and large is doing well compared to other states. But for those that are waiting in line, for those that are worried about this vaccine, we're all anxious and we want Texas to do as good a job as possible. We know that there are moms and dads and healthcare workers and many others that are coming forward and many that are hesitant to come forward because of the current climate around immigration, because they maybe don't have health insurance, but there's significant portions of our population that are very hesitant. When we looked at a recent survey, which Dr. McClendon will talk about in a little bit, we saw that in Dallas County, 36% of the population said that they were very likely to take the vaccine. In Tarrant County, that number was 37%, just a little bit higher. But overall, what this means is that over 60% in the North Texas area and the DFW area are either somewhat hesitant or very hesitant to take this vaccine. So we need a better long-term plan. We know that this is going to take a while to vaccinate everybody. This will be going on over the next year, but we need to start developing plans for those people that aren't clamoring like they are right now to get vaccinated. A significant part of our population is a little worried, and we need to make sure that we are able to get to them and give them that right message. When we look at hesitant populations right now, we know that the African-American population has been hesitant. That may be changing a little bit, but still hesitant. The Latino population, hesitant. New immigrant populations, because as I mentioned, this immigration climate, we know that there's some hesitancy there. But one of the areas that I'm most concerned with are those without health insurance. We know that Texas leads the nation in adults without health insurance. And so when we have so many people without health insurance, and that's a population that is a little hesitant about this vaccine, we're going to have to do something to overcome this hesitancy because this is a large portion of our state. We want a plan of action that not only is get your act together and do everything possible, but it's figuring out who's going to need this vaccine and how they're going to need this vaccine. We need to look at the data. We need to do focus groups. We need to figure out how do we create an individual and unique message for individual and unique populations within our state. We need to make sure that to understand that 4% out of 100% is not going to do, but neither is 37 or 36% out of 100% going to do. We need to make sure that to get to this herd immunity, we're talking about significant portions, 70, 80, or 90% of our population that needs to be immunized so that we can really, in the end, conquer COVID-19. We also need to make sure that we have a state and a state government that doesn't politicize what's going on and that we focus on the health aspects. We understand that we need to develop rules. We need to develop policies. We need to have an overall view of this, that we're going after equity, that everyone on the front lines gets it, but over time, everyone has access to it, everyone in our state. We want to get our vibrant economy up and going again. And to do that, need to make sure that everyone gets vaccinated. And that's one of the reasons we're here today, to talk about how do we get together and how do we make sure that all of those that are hesitant are able to say, hey, this is how we do it, and I'm feeling pretty good about it. We need to create those unique messages. So let me start with Allison Winicky from the Immunization Partnership. Allison, what's your take on all of this?
Well, many Texans have lost trust in our public health officials and our politicians because we've heard months of mixed messages from all levels of government that have confused the public, damaged credibility, and really allowed fear and misinformation to spread. But COVID-19 vaccines are the best tool we have to end the pandemic and return to life. And let me be clear, getting a COVID-19 vaccine will save your life. Our Pfizer and Moderna vaccines are about 95% effective after receiving both doses. And they're essentially 100% effective in preventing you from contracting a serious case of the coronavirus. But American medical experts say we need at least 70% of Texans vaccinated, but probably it could be up to 94% of Texans vaccinated just to end the pandemic and return to our lives. But with these problems with trust, messaging, vaccine availability, distribution, and access, these are real hurdles that we need to address, and at the local level, because there's been a lot of passing the buck, and unfortunately, it's our local communities that are paying the price. This is why we need to rely on partners like the Immunization Partnership, Children at Risk, and all of our North Texas partners to fill those gaps. We need to assess communities that have high COVID-19 community vulnerability indexes, which includes things like social vulnerability and high-risk populations. And our collaborative needs local North Texas foundations to step up and help support us craft tailored messages to local residents who may be skeptical or concerned about getting the vaccine so that they can receive trusted, accurate information about how getting a COVID-19 vaccine will save their lives and protect their families. As an example, some data that was just released today showed that Black Americans are vaccinated at a significantly lower rate than white Americans. We're looking at 2 to 3 times less. And this is an unacceptable number, and we cannot allow that to happen in Texas in our communities. And I will also like to implore the Texas legislature to pass legislation to build a more functional state immunization registry, reduce vaccine preventable disease spread in our congregate living spaces, increase vaccine access and equity, and support vaccine research and development. The Immunization Partnership is fighting for Texans to make sure you have access to a COVID-19 vaccine to protect yourself and your loved ones and end this pandemic.
Thank you very much, Allison. Let's look at some of the research. Dr. David McClendon's here with January Advisors. You have a few PowerPoint slides for us, David?
Yes, thanks, Dr. Bob. I want to start by reiterating and digging in a little bit to the survey that Dr. Bob mentioned. So according to a December poll by the Episcopal Health Foundation in Houston, it was a statewide poll. 1 in 5 Texans say they're very unlikely to get the vaccine when it becomes available to them. That's really unacceptable. Only 37% of Texans say that they're very likely to get the vaccine. This has been, as the vaccines rolled out, they found between September and December, vaccine hesitancy has been declining in Texas. But as you can see, there's a lot of work that still needs to be done. And there are a number of groups that remain hesitant. So we know the survey also found that lower income adults, those with less education are more hesitant, so they're less likely to get the vaccine. Younger adults who are less likely to get the vaccine, and also those without health insurance. The survey doesn't speak to all the reasons why, but given that the vaccine is going to be freely available, those without health insurance are probably still concerned if they're going to be charged something. And so we need to dig in more and ask more questions to figure out why are these groups hesitant and what can we do to change their minds. We took the statewide results and two of the important cleavages around age and income that we saw, and applied those estimates to the age and income profiles of all the counties throughout Texas. And so we see, as Dr. Bob mentioned, 37% in Tarrant County said they're very likely to get the vaccine, 36% in Dallas County. In the north, in Collin and Denton County, it's a bit higher, a bit older and richer populations, but still, to reiterate, over 60% of the population is at least somewhat or very hesitant to get the vaccine in the DFW region. Also, as of yesterday, nearly 5% of Texans have received at least one dose of the vaccine. That's similar across the region. So 4% in Dallas and Tarrant and Collin, 3% in Denton County. Just a little behind some of the other major large metropolitan regions in Harris County, Travis County, and Bexar County at 5%. So what we need is a data-informed campaign, which we've been talking about. So we need data, and we've done this recently. We've done all of these things recently in terms of Census 2020 and figuring out how do we get these hard to reach, hard to count populations, many of the same populations that are hesitant to get the vaccine. So we need to track the scope of the challenges we face using data, using surveys, focus groups to understand how people's hesitancy is changing and which groups are still resistant to getting a vaccine. We need to use data to inform the vaccine messaging to reach these hesitant groups, to figure out what are the different messages that can be used and what are the different mediums to reach those different populations. We also need to use geospatial data to identify where are those communities throughout Dallas and Fort Worth, and where are the trusted voices? Where are the church leaders? Where are the community centers? Where are the clinics that can deliver those messages to the communities? Finally, we also need to ensure an equitable rollout of the vaccine to make sure that everyone has access, not just in terms of traveling a short distance to be able to easily get the vaccine, and finally to evaluate the effectiveness of outreach efforts. The state's done a lot to make data publicly available, but more can and should be done at the community level to ensure that everyone can get a vaccine and does get a vaccine. Thank you very much.
Thank you very much, David. Dr. Claire Bikini is a pediatrician and infectious disease specialist with Texas Children's Hospital and the resident health expert for the Texas Family Leadership Council. Dr. Bikini, tell us a little bit about your take on all of this.
Well, thank you so much for allowing me to participate today. As we all know, COVID-19 is a terrible infectious disease. And while children in general have a more mild illness than adults, children are definitely being impacted by this terrible pandemic. In Texas alone, we've had over 500 children requiring hospitalization in an intensive care unit from this virus. We've had at least 35 pediatric deaths related to COVID-19. And there are so many other negative complications in a child's life due to this pandemic. We're seeing kids lose family members, their family members are losing jobs. We're seeing skyrocketing levels of mental health needs, food insecurity, suboptimal schooling, just a tremendous impact on the lives of our kids. Texas is in the midst of the worst surge that we've had since this pandemic started. And while my friends and colleagues and we're feeling it in healthcare, somewhat overwhelmed from the extent of the disease that our patients are facing, we really have hope at this point. And the hope is all because of these 2 vaccines. And I hope that we have more vaccines in the coming few weeks. Of course, we still need to wear masks and social distance, but at this point, I really do believe that these vaccines are going to be the light at the end of this very long tunnel. These vaccines are safe and they're effective. And it's essential that all members of our community have the opportunity to learn about these vaccines so that they feel comfortable getting vaccinated. Both of these vaccines that are currently under the FDA's emergency use authorization have been well studied. It's important to note, one thing that I'm hearing is that these vaccines were just studied too quickly. And the fact of the matter is that they were record fast studies, but it's because we put money into it, and it's because the public wanted to volunteer because this is such a devastating virus. And so these studies were actually carried out with the same scientific rigor as any other vaccine study, they just happened faster. It's really important to know that 90 to 95% of all vaccine adverse events happen within the first 2 months after getting a vaccine. And both of these vaccines have been studied for a minimum of 2, most 6+ months. And so we absolutely know these vaccines are safe. We also know that these vaccines are very effective, 95% effective at preventing you from getting COVID-19 disease, and almost 100% effective, as Allison told you, at preventing you from getting severe COVID-19 disease. So it's really important that our state works together with local community leaders and scientists to educate the public and combat any vaccine hesitancy that there is around these life-saving vaccines. I was asked to discuss some of the side effects of the vaccines, and I think it is important to acknowledge that these vaccines do have side effects. You know, the most common side effects are a sore arm, fever, fatigue, you know, just having body aches, joint pain. I definitely had a sore arm and fatigue for 2 days after both of my doses of the vaccine. But the fact of the matter is that this is not you getting this virus from the vaccine. This is your body learning, your immune system learning how to protect you from the vaccine. So it's just so important to recognize that these side effects they happen, but they are not, you know, in the long term dangerous. Up to a third of some people, you know, do need to take off a day of work because of the vaccine. And I understand that that's not trivial, but at the same time, it's a small price to pay to be able to protect yourself from this devastating disease. I was also asked just to comment briefly because there's been so much press around allergic reactions related to these vaccines. It's important to understand that these vaccine allergic reactions are incredibly rare and they're very treatable. And so it's what we do when we give the vaccine is we monitor patients for 15 to 30 minutes to make sure they don't have an allergic reaction. If they do, we treat them. But again, these allergic reactions are extremely rare and very treatable. You know, this is such an enormous and challenging endeavor to try to vaccinate all the Texans who are eligible for the vaccine. And I definitely want to acknowledge the fact that Texas has done better than the vast majority of states. We actually were the first state to get to 1 million doses of vaccine administered. We've vaccinated more people than any other state. But at the same time, we do have a lot of challenges. And I think that it's going to be very important to work together. I love being part of this collaborative because I think that's going to be part of how we can kind of help move forward and help our state overcome some of the barriers. I know, you know, from taking care of patients that we have a lot of people who are facing barriers to the vaccine, living in rural communities, you know, not having reliable access to the internet, which is the primary way that people are signing up for vaccine appointments right now, not having access to reliable transportation, fear of being charged for the vaccine, as you talked about, being uninsured. These are all issues that we face in patient care in general, and we try to help patients overcome these barriers all the time, but we have a lot of work to do as a state to try to help patients overcome these barriers when it comes to getting the COVID vaccine. And finally, I just want to emphasize that I think that vaccinating adults will have a huge impact on the lives of our kids. We know that children are primarily getting COVID from their adults. And so by vaccinating adults, we will be protecting children. We'll also have kids stop losing family members to this terrible virus. We're going to have kids, you know, families doing better economically so that they can, you know, be less food insecure. They'll get back in school. We'll have less problems with mental health. I absolutely have hope with regard to this, you know, pandemic, and my hope is completely on these vaccines. And so certainly we want to work as much as we can together to help people feel comfortable getting vaccinated and have access to the vaccine. Thank you.
Thank you very much, Dr. Bikini. From Cook Children's, the Medical Director for Health Equity is Dr. Anu Parktop. Dr. Parktop, your take on all of this.
You know, all of you done a great job of painting both a bleak and a hopeful picture of, I think, where we are right now in this pandemic. I'm actually really hopeful because the numbers that we've said, right, 36%, 37% are willing. That's actually pretty good when you consider what a horribly distrustful year 2020 was. To still have a third of the people believe, yeah, give me the vaccine, I think is a good starting place for us to build from. Texas is so huge. As I was listening, it really occurs to me that we can't be one size fits all in this state. So what's happening to children locally in North Texas has been very different for my partners who work out in West Texas. And in trying to navigate that message, I think that's where we have some opportunity, right? Is to say, community health has always been about local partnerships, bringing together people at a local table, at a local Zoom, in order to tackle what the perceptions, beliefs, concerns are at a very human heart-to-heart level. I think data allows us to know how big of a problem we have, but it's going to be our hearts that get together to solve this problem of distrust. The vaccine isn't about believing in it as much as it's about trusting the science, and that trust is not going to come as wonderful as this whole group is, it probably won't come from any of us, right? But it can come from us leveraging the partners that are trusted faith leaders, trusted community leaders, people who've already gotten the vaccine. We have leaders from vaccine hesitant communities who have received the vaccine. Let's help them showcase what they felt in their decision making, the day they got it, and how protective they feel they're being to the community around them. When I think about the impact on children, Claire really said it well. There's so many ripples. I mean, our children have always been the canaries in a community, and it's no different now. But we're not seeing it. So when they are at home instead of school learning, we don't see it as a community. When they're not on a football game cheering, doing things they probably shouldn't be doing and enjoying the game and playing the game, when that doesn't happen, we don't see it or feel it the way we should. We've gotten almost numb to the requirements to socially distant, and the people that can't afford that are our children. Their social, emotional, developmental, and mental health is counting on us getting this right. And the only way to get it right now is a vaccine. And that conversation has to happen with communities around a table, around Zoom. I got to drop the table right now, right? I want to kind of say what my last point is. It's a somber note, but this is the reality of what we're talking about. Yesterday, I joined in on a Zoom for the very first time for a funeral service. I hadn't done that yet this pandemic, and it was very surreal. And if you haven't done it, I think people really need to picture what this is for families. That there are families who've lost someone to a disease that was not preventable until recently, and that these family members are gathering very few at a time with the masks on, sitting side by side in a very, in a way that we were never meant to grieve. This is not how we grieve as people, is with a mask on side by side with very few. And that your community of support is on a Zoom, listening and crying individually at their computers, and they can't be with you. We cannot get numb and used to what this has been. And that experience is more heavily present in our communities of color, in our communities who have lower incomes, and our communities whose frontline jobs we have counted on being there for us when we need food or services. And the vaccine is our only way to go back to normalcy. There is no other way at this time to go back to normalcy for everybody, and especially our kids.
Thank you, Dr. Parktop. Thank you very, very much. What a horrible thing seeing a funeral on Zoom. I can't imagine. Leah King is with us. She's my good buddy. She's the president and CEO of United Way of Tarrant County. And Leah, you're working with families all over North Texas. What's your take on when we talk about this vaccine and the hesitancy?
My take is this, and it really comes down to years and years of distrust. This didn't just start with this vaccine. The problem we have is that we didn't fix it before we got into this pandemic. And so we know that healthcare disparities happen for a variety of reasons, whether it be just systemic racism, whether it be economics. I mean, there are just so many reasons here. So when I look at the numbers of people who say they are willing to get the vaccine and those who are unwilling, I don't only see it being just about this conversation today. And so what we need to do is have this conversation today because we are in an urgent life and death situation. But what we have to do is commit to understanding and acknowledging the wrongs that have been done to communities of color for generations and dismantling systems that are barriers to large populations whom we serve that have no reason and no desire to engage and trust with these systems. There are so many ways to do that. We're very fortunate here locally in the Fort Worth area that we have a great relationship between TCU and UNT Health Science Center, and they are producing our next generation of medical professionals. And they're very cognizant of these issues and are including as part of their curriculum, not just the typical bedside manner and all that, but truly understanding historic issues that have occurred multiple times and why certain populations are not believed when they say they have pain. We know that Black women have a major challenge when dealing with healthcare professionals. And I don't want to have it appear that I'm coming down on healthcare professionals. We would not be where we are today. Truly, my heart aches for so many of them who are seeing things that literally they should never have to see. But what I'm saying is, from an institutional perspective, from a training perspective, that we have to go a level deeper and understand that the only way to prevent the next pandemic or even the next bad flu is to deal today and stop kicking this can down the road of why this exists. All of my fellow panelists really hit on the results and just some of the challenges that people are experiencing with accessing, whether it's technology, access to transportation, information, and things like that. But we also need to understand and acknowledge that we have some deeper issues that until they are addressed, we'll continue to find ourselves right back here at the next pandemic or major outbreak of some type of illness.
Thank you, Leah, very, very much. Thank you all for being a part of this. Let me just a few words for the Spanish-speaking press. Alguna palabra para la prensa latina. Mira, sabemos que estamos preocupados con lo que está pasando con nuestra población, especialmente la población latino. Sabemos que hay personas que no saben si quieren la vacuna sobre el COVID-19. Y esas personas son la mayoría de latinos, un gran por ciento de personas que son de la población inmigrante, un gran por ciento de la población que son, que no tienen seguro de salud. Estas partes de la población estamos preocupados porque para ellos necesitamos que ellos saben que necesitan la vacuna para el COVID-19. Y lo que queremos es un mensaje especial para esas partes de la población y que queremos leyes, reglas que vienen del gobierno y ayuda del gobierno para que cada persona en nuestra comunidad pueden tomar esta vacuna que es muy, muy importante para toda la población. All right, guys, and that's about it on that. And thank you all very, very much for the hard work that everyone's doing. And thanks for being part of the press conference today.
Thanks.